Oscimin, also known as hyoscyamine, is used to treat a variety of stomach and intestinal problems, such as cramps and irritable bowel syndrome. It can also be used to address bladder and bowel control issues, as well as cramping pain caused by kidney stones and gallstones, and even symptoms of Parkinson's disease. Additionally, Oscimin can be used to reduce the side effects of certain medications and insecticides. This medication works by decreasing acid production in the stomach, slowing down the natural movements of the gut, and relaxing muscles in many organs, such as the stomach, intestines, bladder, kidney, and gallbladder. It also lessens the amount of certain body fluids, such as saliva and sweat. The dosage and timing of Oscimin can vary depending on the specific condition being treated, so it's important to follow your doctor's instructions carefully. When taking Oscimin, it's important to follow your doctor's instructions. Typically, you should take it 30 to 60 minutes before meals. The dosage will depend on your medical condition and how you respond to the treatment. It's crucial not to increase your dose or take it more often than prescribed without consulting your doctor. Adults and children 12 years and older should not take more than 1.5 mg in 24 hours, while children aged 2 to 12 years should not take more than 0.75 mg in 24 hours. It's important to talk to your doctor or pharmacist for more information. If you also use antacids, be aware that they can lower the absorption of hyoscyamine. To manage this, take antacids after meals and take hyoscyamine before meals. Alternatively, take antacids at least 1 hour after taking hyoscyamine. While taking this medication, make sure to drink plenty of fluids unless your doctor advises otherwise. And as always, be sure to inform your doctor if your condition lasts or gets worse. Some common side effects of Oscimin may include dizziness, drowsiness, blurred vision, dry mouth, headache, and trouble sleeping. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to inform your doctor immediately if you experience any serious side effects such as mental or mood changes, fast or irregular heartbeat, difficulty urinating, decreased sexual ability, loss of coordination, trouble speaking, or vomiting. In the event of very serious side effects such as eye pain, swelling, or vision changes, seek medical help right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you experience symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, and if you experience any other effects, it's important to contact your doctor or pharmacist. Remember, always consult your healthcare professional for medical advice about side effects and report any side effects to the appropriate regulatory agency. Before taking Oscimin, make sure to inform your doctor or pharmacist if you have any allergies to hyoscyamine or atropine. It's important to also discuss any medical history you may have, especially if you have conditions like enlarged prostate, urinary blockage problems, certain stomach or intestinal issues, glaucoma, heart problems, high blood pressure, kidney disease, or nervous system problems. If you wear contact lenses, you may need to use wetting eye drops as Oscimin can cause dry eyes. This medication may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can intensify these effects. Be cautious when driving or operating machinery, and limit your alcohol intake. If you're using marijuana, be sure to talk to your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Oscimin can increase the risk of heatstroke by decreasing sweating, so it's important to avoid becoming overheated in hot weather, saunas, and during exercise or strenuous activity. For older adults, there may be an increased sensitivity to the side effects of this drug, such as confusion, drowsiness, excitement, constipation, and difficulty urinating. This can increase the risk of falling. Children may also be more sensitive to the side effects. During pregnancy, Oscimin should only be used when clearly needed, and it's essential to discuss the risks and benefits with your doctor. This drug can pass into breast milk, so consult your doctor before breastfeeding. It is important to be aware of potential drug interactions with Oscimin. Some products that may interact with this drug include certain azole antifungal drugs, bisphosphonate drugs, corticosteroids, digoxin, potassium tablets/capsules, and pramlintide. It is also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, it is important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. This medication may also interfere with certain lab tests, so it is important to inform lab personnel and all your doctors that you are using this drug. Remember to keep a list of all the products you use and share it with your doctor and pharmacist, and do not start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to call for emergency assistance right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Symptoms of an overdose may include hot and dry skin, fever, unusual excitement, fast or irregular heartbeat, and seizures. Always seek immediate help if you suspect an overdose of Oscimin. This medication should not be shared with others. In addition to taking this medicine, it is important to consider making lifestyle changes to manage digestive disorders. This may include participating in stress reduction programs, incorporating exercise into your routine, quitting smoking, and making dietary changes. Talk to your doctor or pharmacist about lifestyle changes that could help improve the effectiveness of this medicine. If you forget to take a dose of Oscimin, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to keep Oscimin at room temperature, away from light and moisture, and not in the bathroom. It's important to store all medications out of reach of children and pets. Remember not to flush Oscimin down the toilet or pour it into a drain unless specifically told to do so. When it's expired or you no longer need it, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.